Hi, this is Ben. Now for a brief discussion of the renal tubular acidoses, or RTA. These are a special type of acidoses, so they do fit into general acid-base schematics, but they're special because they result directly from dysfunction in the kidney. Type 1 is also known as distal renal tubular acidosis because it results from a defect in the ability of the alpha intercalated cells in the collecting tubule to secrete hydrogen ions. Quick question, why would this result in hypokalemia? As sodium is reabsorbed in the collecting tubule, this creates a negatively charged lumen potential. Normally both hydrogen and potassium ions flow into the tubule to balance the charge. Since hydrogen ions cannot be secreted in type 1 RTA, more potassium will move into the filtrate. There is also increased risk for kidney stones because the urine will have a higher pH, thus making it easier to precipitate calcium phosphate. Causes of type 1 RTA include amphlotericin B toxicity and analgesic nephropathy. Type 2 or proximal renal tubular acidosis results from a defect in the proximal tubule's ability to reabsorb bicarbonate. However, the ability of the alpha intercalated cells in the collecting tubule to secrete hydrogen ions is intact. This results in decreased pH of the urine as the body tries to compensate for the acidemia. There is also a hypokalemia. Why is that? The bicarb that failed to be reabsorbed in the proximal tubule travels to the collecting tubule and brings sodium along with it. As the sodium is reabsorbed in the collecting tubule, it will create a higher negative lumen potential. This will result in increased potassium and hydrogen ion secretion into the filtrate. Causes of type 2 RTA include Fanconi syndrome and proximal tubular toxins like lead and aminoglycosides. Lastly, we have type 4 or hyperkalemic renal tubular acidosis. This results from hypoaldosteronism or the inability of the collecting tubules to respond to aldosterone. Therefore, hydrogen ion and potassium secretion are both reduced. This type is most commonly seen in the condition of diabetic nephropathy. Thanks for listening and hope you learned something.